This is Mark Gilbert. You notice the sweat on his head. He is all worn out now. It is 4:30 in the afternoon and he's exhausted. And it's not because he's done a lot today. It's because he has a disease called Wegener's granulomatosis. This is a pile of bills received today. 104 bills, all from the same company. The company is a bill collection agency from University of Michigan Hospital. Mark has been going to University of Michigan Hospital for approximately 10 years. He was not diagnosed there, but only they have saved his life. This is Mark Gilbert's son. He is 12 years old, now 13, and he's never known his father to be well. Can you tell me a little bit about your dad?
Well, I've known my dad since I was born, of course. I've never seen him without pain, actually. It's kind of sad.
What kind of disease does your dad have?
It's an autoimmune disease. The doctors call it Wegener's granulomatosis.
How does it feel? How does it make you feel when your dad is too sick?
Actually makes me kind of sad and angry. He actually does think it's actually his fault it's sick, but it's not.
Tell me about when you were 9 years old and you had to take care of your dad all by yourself because your mom was gone.
That was dreadful. My mom was at a con in Indiana. I was at home. We were going to go to the next day, but then my dad got viciously sick. I don't know what the pills called he took, but it gave him a really bad reaction. I will always remember that day. Puking everywhere. I actually did make my own food, like I usually do.
You were 9 years old. You shouldn't have had to worry so much.
But then I did. At that time I did.
What happened to your dad?
They would have flown him to the University of Michigan Hospital, but it was too snowing in April. So they medevaced him out in an ambulance to the hospital. Then they brought him to the University of Michigan.
Were you scared?
Yes.
Why?
Because I'm afraid my dad was going to die, and I'm so glad he didn't.
Now tell me about your mom.
My mom, big Star Wars fan. Can't deny that. The bad part is that she had cancer twice and survived twice. That makes me really proud of her.
How old was she when she had her first cancer?
Really young.
How young?
When she was a baby.
And what happened then?
She had to get one of her eyes removed, and the doctor put to her plastic eye, or some little part of the glass eye. Okay.
And what about her last bout with cancer?
That one really surprised me because it's actually skin cancer on the head. She did have a scab on her head for a very long time. No one knows how it got there until it really started bothering her, and then she went to the doctors and she found out it was cancerous. Then she got radiation therapy. I don't remember how many times, and that got rid of it.
When did this happen?
Last year.
So your dad was sick and your mom had cancer at the same time. You're a strong kid to put up with all of that.
I agree. This is my mom, Carol Gilbert. Now, I have a question for you.
Okay.
What is Wegener's granulomatosis?
Well, this little pamphlet has always said it the best. I'm just going to read what it says.
Alright.
Wegener's granulomatosis is an uncommon disease that affects about 1 in 20,000 to 30,000 people. Symptoms are due to an inflammation that can affect many tissues in the body, including blood vessels, which makes it a vasculitis. It is also considered a disease of abnormal immune function. Some consider it an autoimmune disease, meaning that the body's immune system attacks its own body's tissue. There is no known cause for Wegener's, but it is not contagious, and there is no evidence that it is hereditary. It is systemic, meaning that it affects the body as a whole, and it can affect the upper and lower respiratory system, the upper being the sinuses and the lower being the lungs. and can also involve the kidneys, eyes, lungs, ears, throat, skin, and just about anywhere else. For reasons not clear, blood vessels in those areas may become inflamed and clusters of certain cells called granulomas may occur. So that really says it pretty well. There is no cure for Wegener's, but if you're really lucky, you can get into remission. There is help out there, though, for those who have Wegener's and those who have cancer also. There's a great community message board system out there on the Yahoo mailing lists called WG Discussion. You can find out a lot of information there between patients and caregivers. You can talk, you can vent, you can tell jokes. There's also photos up on the website of patients and caregivers also. There's the Vasculitis Foundation, which is the font of all knowledge for vasculitis and Wegener's granulomatosis. There is hope. There's always looking out for a cure. I have always thought that this disease was misdiagnosed a lot as sinus infections. That's how Mark started out, with a huge bad sinus infection, which never went away, and later we found out that it was Wegener's granulomatosis. It was a very hard diagnosis to make. They had him in isolation in the hospital for 2 weeks because they didn't know what the nodules on his lungs were for. And eventually somebody thought about it being Wegener's and did the blood test, and we've been going ever since. He's had a lot of problems in between. Some of the medications he couldn't tolerate, some of them he could. But he's never really fully been in remission to the point where he has been off all of his medications. So he has never truly been into a full remission, but he's still kicking, he's still going, and he does his best for our family.
Peace.